How important is it to your health care plan to get rid of private insurance companies? Because there's some confusion about that.
Yeah, so I'm glad you asked. So the bottom line and the most important is that everyone have access to health care. That is the goal. That is the purpose for me supporting the policy of Medicare for All.
You know, what she said as a senator is a lot different than what she says as a presidential candidate. She's saying the same thing, but it's getting a lot more scrutiny because she's a prominent and right now a front-leading Democratic candidate for the presidential nomination. What she said was eventually to get rid of private health insurance in favor of Medicare for all. She's finessed it somewhat there, talking a little bit about some of these other issues that are getting a lot of attention. We have the Director of Public Policy, Jenna Ellis, over at Dobson. We also have the Fox News contributor, Katherine Timpf, progressive commentator, Rashad Richey. Rashad, to you, how big a deal is this distinction she draws, saying in the quest for Medicare for all or coverage for all, the goal is the same, health coverage for all?
I think it is a big deal how you word things in a presidential election. So let's be clear. Insurance companies are not in the business of making you healthy. They are in the business of making money. A lot of people are actually in favor of Medicare for all until they realize that it de facto eliminates private insurance companies. And some studies suggest that within 4 years, a single-payer system would eliminate all known private insurance companies. But I think she is on a route in her presidential campaign to have a Bernie Sanders-like movement as it relates to health care reform in the United States. And I believe we have room for that conversation.
Kat, do you think the quest for Medicare for all, which would seem by extension to mean private insurance for none, if that's the route you're going to go, she has to clarify that? Or did her distinction today that her goal is to make sure everyone has health coverage enough for the time being?
I think that she absolutely needs to clarify that because it's something that matters to Americans. A recent poll showed that the majority of Americans who do have an employer-sponsored plan are happy with that plan. And Medicare for all means if you like your plan, too bad, you can't keep your plan. And that's what he was alluding to earlier, previously Rashad was alluding to earlier, is that when Americans find out that Medicare for all would eliminate all private insurance companies, only 37% of them say they support that. So there really isn't the kind of support here that she needs in order to get votes. A lot of people are scared of this idea of socialized medicine. It may be something that plays well in super left circles, and being super left can get you a lot of media coverage if you look at AOC, if you look at Bernie Sanders. But when it comes to average Americans, a lot of Americans don't want to hear language like that, and they like the insurance plans that they have already.
It depends if they're delivering the goods for them. But Jenna, I am wondering in this idea that many people thought that Obamacare or the Affordable Care Act was dead. I mean, all of these candidates are saying a variation of coverage for everybody is still alive and well. The buzzsaw that the senator ran into was apparently, torpedoing private plans. Initially, that was the perception in favor of something government-run to do it. But that is the direction the Democrats are in.
Yeah, and the progressive left is continuing in that direction, and we know that single-payer health care is not economically viable or even constitutionally available. But I think that there's a more sinister reason why the progressive left is so focused on single-payer health care, and that's for state-sponsored abortion coverage. When you have private companies like Hobby Lobby and you have religious organizations like Little Sisters of the Poor who have the Supreme Court's backing for religious exemptions to not have to provide coverage for contraceptive use or for state-funded abortions or for private payer abortions, then you have to have single-payer health care so that we have state-sponsored abortions. Then the progressive left will advance their sexual revolution agenda, and they will then run the fallacious argument of separation of church and state and say that under single-payer health care, government has to sponsor abortions. And when we look at the laws coming out of New York, coming out of Virginia, and this emphasis on abortion, that's really what this is all about.
But, you know, Rashad, it's also a money issue, right? I think it's a good thing that something like this occurred early in the campaign, and what I can't believe we're this early into it, where they're already announcing, but that you have to find a way to pay for something you're proposing. And then the hard lesson here for the senator, whether it was by accident or design, is people are going to come back to her and say the only way you can get Medicare for all is to junk private insurance for all as well. And she ran into that reality. So math might be a bigger issue than right to life, right?
Yeah, and that may be true, but I don't think she has the ability right now to calculate how much this would really cost, because the truth is, Neil, nobody actually knows. Nobody knows how much this would really cost in the final analysis.
I know it's very early, but what makes her a front runner? She's drawing huge crowds, big ratings, big attention, Barack Obama-like. Why?
Because she's dynamic. She has a credible voting history as it relates to those in the Democratic establishment. She actually does have a liberal voting record as a U.S. Senator, as short-lived as that has been. But, Neil, I think her bigger issue is not really to sell this to the general American voter, but really her own party. You have U.S. Senators like Tim Kaine and others who are not there yet as it relates to eliminating the private payer system and extending Medicare for all. So even within her own ranks, you do not have a general consensus yet.
Well, she is a target, so that might be speaking something to her appeal. Kat, what do you make of that?
I mean, right, she is a target. She is a likable person, right? She had a huge rally. She had 20,000 people there when she gave that speech. She obviously has some appeal, so she's obviously going to be a target. But at the same time, I think that we're going to see the Democratic field be much wider. We're going to have a lot more people still announcing. So I think she just announced at the right time. I think maybe Elizabeth Warren announced a little too early, but she is able to get people excited, and we can see that that's something that does matter. I mean, if you look back to candidates from Barack Obama, President Trump, these are people that people got excited about, and people definitely are excited about her in terms of likability and those sorts of things.
I want to thank you all. Thank you very, very much. All right, in the meantime, here's the thing when you come out with a book and you start a book tour. Suddenly it's not about the book. It's about what you're saying on the book tour. Chris Christie is finding out the hard way after this.